Hello, welcome to Module 4. Modern healthcare nursing does not exist in a silo. Our ability to provide for our patients requires collaboration and effective interprofessional communication. This means we communicate constantly throughout our workdays as nurses. This can look like expressing the nursing perspective during physician rounds. They can be discussing IV compatibility with a pharmacist, or even discharge teaching with our patients. Sometimes we find ourselves in formal leadership roles. These critical conversations can be related to resolving conflict around a misbehavior. It could look like interviewing new graduate nurses for a staff position. It could be navigating scheduling or education or even training opportunities. Regardless, we treat these conversations as mysteries to be solved rather than, crimes to be punished. We want to promote a just culture, and obviously this is part of that. We learn from each of these conversations, and our hope is to improve, especially considering that many of these conversations don't actually go very well. Um, the main assignment this week is to meet and interview a leader. It could be a nurse manager, a charge nurse, or really anyone you perceive as a leader, but just check with us to make sure your choice is acceptable. Probably is. Um, there is a worksheet with guidelines to walk you through this endeavor. Not only is this an example of professional communication, um, but it's also a practice in networking. Finally, in preparation, there are some readings. There are a couple videos that you should watch. There's, if you choose a podcast you can listen to. Otherwise, keep us posted. We're looking forward to seeing the results. Thanks.